Oh, right. Yeah. Okay. Now, why is this getting? Yeah. Shall I close this here? Please. Hmm? What shall I do? Just go ahead. Yeah. You are anyway through that, no? So you should know here one very important thing. What are the muscles supplied by the facial nerve and what are the ones which are supplied by the fifth cranial nerve, right? Now, let's see. Digastric posterior belly is supplied by the facial nerve, whereas anterior belly of the digastric is supplied by the mandibular, the mylohyoid nerve, right, of the trigeminal. Trigeminal has three divisions. What are they? Ophthalmic, maxillary, and mandibular. So it is the mandibular divisions branch, which is the one which is supplying the anterior digastric is what we need to basically remember. And the suprahyoid muscles, they are all innervated by once more mandibular division of the fifth cranial nerve is what you need to remember. Now you answer this question. A patient has a burning pain and numbness over the anterolateral thigh after prolonged standing. There is a sensory loss, but no motor deficit, which is a very, very important clue. So, which nerve is affected in Meralgia paresthetica? Actually, it is also image-based question. So, but anyway, for Meralgia paresthetica, what is the nerve, doctor? Lateral femoral cutaneous nerve. What is the root value, doc? It is L2 to L3 loss is responsible. What is characteristic? It is a purely sensory nerve, lateral cutaneous nerve. That's the reason you don't have any motor weakness at all. So that's the reason there is no motor weakness, but only sensory involvement is the important clue to say it is Meralgia paresthetica. All right. Now, the next question. Punch your answer. A patient presents with an ankle swelling after forceful eversion injury while playing football. Which ligament is most likely involved, doctor? Very nice to see Dr. Abbas Syed. Very good. What is your good name, doctor? Very good. Pavani. Pavani, login in the? Should? What is your answer, doctor? A patient with ankle swelling after a forceful inversion. Very good. Rajesh, Shruti, Sri, Lakshmi. Annipansalla? Sixth question. But I think adi koncham +4 weightamlo miss kodutundi. I'll tell you. So remember, doctor, eversion aయిందనుకోండి foot. Whenever there's an eversion injury, deltoid ligament is the one which is involved. Whenever there's an inversion injury, Then it is anterior talofibular ligament, which is basically injured. What is the strongest ligament in the ankle? Deltoid is what you need to remember. And deltoid is also the medial ankle stabilizer, is the point you need to remember. Now, during a actual question is this, during hyperextension injury of the shoulder joint, a long head of triceps may get detached from its origin. So you need to know, long head infraglenoid, whereas other heads are from the humerus origin in the triceps. And ultimate insertion of triceps is into the olecranon, is what we need to remember. Right? Good. Pavani, you are able to join, right? Yes, good. Let's look at the next question. Actually, a histological specimen was given. It was showing a pseudo-stratified ciliated columnar epithelium with goblet cells. Which organ has that? So remember, doctor, there are 20 histological images you need to remember for the NEET PG. Right? I will send you all those histology images and what are the 20 histological images? You're in WhatsApp group, right? Right. So I'll send you in the WhatsApp. 20 to remember. Okay. What is your answer? Very good. So 2 of you correctly answered. Only scoring it is doing wrong. Trachea. Right? Somebody here answered it as intestine, but not so. Now, so doctor, respiratory epithelium is all pseudostratified ciliated. Goblet cells, they produce mucus secretion. That's the reason why you need cilia in respiratory tract, because all that mucociliary drainage you need to lead to is what we need to remember. Now, patient develops pulmonary embolism, leading to the obstruction of the pulmonary blood flow. Now, what change occurs whenever pulmonary embolism is there for the ventilation perfusion relation? Very easy question. Ventilatory perfusion, numerator में क्या है? Ventilation. Perfusion में क्या है? Denominator. If there is any block, pulmonary embolus, perfusion get affected. So if the denominator decreases, fraction value increases. So what is your answer? Good. Very good. So 5 of you correctly answered. 5. Ikkada 4 unnaru, inkokalla evaru unnaru? Moni also joined. Must be Monica. Yeah. So good. Is it voice clear in the YouTube? Clear? Good. Very good. So just to type in the YouTube, students to log in into neetpg.app in order to directly punch. So pulmonary embolism, what will happen, doctor? Ventilation is maintained, but perfusion is decreased. That's the reason there is a high V by Q ratio, is what you need to remember. Hydrochlorothiazide is used to prevent recurrent calcium kidney stones. What is the main mechanism preventing the stone formation? Hydrochlorothiazide. Always remember, loop diuretics lose calcium. Thiazide diuretics retain calcium. Right? Loop diuretics lose calcium. Thiazide diuretics retain calcium. Let us see how many of you are right. Right? Very good. So you can see 5 of you correctly answered. Increased distal calcium reabsorption. So amount of calcium in the tubular fluid is decreased. That prevents the calcium stones. So thiazides decrease urinary calcium and they typically prevent the kidney stone formation is what we need to basically remember. Now, the next question. In a physiology experiment on muscle contraction, so I'm teaching even to my son who is in 12th class. Akkada sarcomere, A band, Z band, ikkada ade. So what is your answer, doctor? So sarcomere length tension relationship is plotted. Actually, sorry, the image is missing. Next time I'll add images. Okay. So the point over here is maximum active overlap, peak active tension. Sarcomere length is 2.2 micrometer is what we need to remember. So next, doctor. Which of the following is a mitochondrial inheritance, easiest in the planet Earth? Always remember, rate-limiting enzyme disorders are all autosomal recessive. Structural protein disorders are all autosomal dominant. So in this, which one is mitochondrial inheritance? I know you are tempted to answer Williams, right? Or MERRF. Mitochondrial encephalopathy with ragged red syndrome. Right, doc? So let's see. Very good. Only one of you answered correctly, which is Kearney-Sayre syndrome. Williams is a temptation for everybody. Cystic fibrosis, though, not at all acceptable. That is autosomal recessive. So maternal inheritance, Kearney-Sayre is classical, where you have ophthalmoplegia with muscle weakness is what we need to remember. Most of the mitochondrial disorders present with muscle weakness because for muscle you need energy. For energy you get from mitochondria. That's how you need to basically remember. Okay, so what are you going to promise yourself? Autosomal dominant, recessive, mitochondrial, then X-linked, recessive and dominant. ఒక్కొక్క దాని మీద 10 points. అంటే 50 points आपके मुट्ठी में रहना. Right? Tonight I will send you in the WhatsApp those 10 points on each of the inheritance patterns. Come on. A healthy man climbs the mountain for trekking and hyperventilates due to hypoxia. What is the primary acid-base disturbance that you need to remember? Those who are online, not in the class, need to tap on the video for listening the voice. Is it audible? Okay. So, doctor, we are having Pavani, Lakshmi, Shruti, Shri, Satvik, and many more who are all online. Actually, in this positive marking, it is having error. Otherwise, yeah. Whenever high altitude hyperventilation is there, carbon dioxide is washed out and that leads to respiratory alkalosis, right? So you should know, low CO2 is respiratory alkalosis. High CO2 is respiratory acidosis. Whenever our ventilatory rate comes down, what do you get? Respiratory acidosis. Whenever your ventilation increases, anxious, hysterical, that lead to respiratory alkalosis. All right. Acid-base disturbance is something that you need to be 100% sure. Now, doctor, pH 7.28 means acidosis. PaCO2 60 is definitely increased. That means hypercarbia. Right. Nice to see JJ Singh joining the online game. Very good, doctor. Yeah. Yes, sodium is 142. Kota is also joined. Excellent, Dr. Kota. Now, sodium 142, chloride is 100. Yeah. Very good. So what is the anion gap? Sodium plus potassium minus chloride plus bicarbonate will give you the anion gap. Is very easy to remember. So in this case, 142 minus 100 minus 28 will give you the value in this given case. Normal value of anion gap is 12. And what are the two causes of normal anion gap metabolic acidosis? Very good. RTA, renal tubular acidosis, and diarrhea. Okay. Next. A child has fractures, petechiae, perifollicular hemorrhage, and gum bleeding. Which vitamin deficiency? Very good. Vitamin C. What is dependent enzyme? All the hydroxylases are dependent on the vitamin C. That is the reason. What is your answer? Very good. Let's see. 3 of you are correct. It is the prolyl hydroxylase which is responsible. But 2 of you are tempted to tyrosinase. Oh my God. Right? So, the next question. Patient has jaundice, develops bleeding, which resolve after vitamin K injection. What is the possible cause? Vitamin K injection. What is the probable cause in vitamin K deficiency? Why does it happen in liver? Then what get affected? Vitamin K dependent factors. What are they? 2, 7, 9, 10 is what you need to remember. Yes, doctor? Yes, let's see what is your answer. It is the biliary obstruction, right? The probable cause is the bile needed vitamin K, fat soluble vitamins that actually 2, 7, 9, 10 mein 9 deficiency is also responsible. That's good answer. There's no big deal about it. So what is the only factor in extrinsic pathway? 7. What is the common pathway PTA, BTT? 2, 5, 10. Everything else belong to intrinsic pathway. 7 is extrinsic pathway. PT. 2, 5, 10 common pathway. Everything else intrinsic pathway. Come on. So once more, we will go in more detail about the clotting pathways. A man trapped without food for 5 days in a NEET PG hostel, preparing for NEET PG entrance with no gas available from Iran. What becomes the primary source of energy for the brain? Dr. Murali Bharadwaj classes. Yes. So, feeding, starvation. Every entrance you go, feeding, starvation, biochemical changes. Favorite question. Right, doctor? So, it is the ketosis, right? 5 days, right? So 3 to 5 days of fasting, it is the acetoacetate. What are the 3 ketone bodies? Beta hydroxy, butyric acid, acetoacetate, and acetone need to be remembered. All right, doc. Good, very good. And what is the only organ in the body that can produce ketone bodies? Fast. Liver. And the only organ in the body which cannot use ketone bodies, everything else can use. Mummy can prepare food, but mummy can't eat it. Liver is the only organ that cannot. Okay? Now, the patient has elevated phenylalanine, but normal phenylalanine hydroxylase levels. Which cofactor deficiency is responsible? Beautiful question. If it is phenylketonuria, then phenylalanine hydroxylase levels are low. But idhar to wo normal hai, fir bhi phenylalanine elevated hai. So what is the underlying cause? What else is needed for metabolism of the phenylalanine in addition to the enzyme? Yes. Very good. So you should remember, uh, yeah. So you should remember tetrahydrobiopterin cofactor deficiency can lead to hyperphenylalaninemia is what we need to remember. Okay. What is the urinary finding whenever vitamin B12 is deficient? ఫట్టమని చెప్పాలి. అన్ని వీడియో యాప్లన్నీ ఉంటాయి కానీ మనము ఫండమెంటల్స్ మిస్ అయిపోతుంటాం. Come on. Methyl malonic aciduria. What is the enzyme which is dependent on methyl malonic? Methyl melanin acid metabolism require vitamin B12. Okay, come on. What is the next question? Patient with vitamin B12 deficiency has elevated homocysteine and neurological findings. Which amino acid synthesis is affected, doctor? Vitamin B12 is needed. Which amino acid? Yeah. What's your answer? Come on, come on, come on. Yes. 7 of you correctly answered. Methionine. Malokati. अभी 25 साल हो गया मैं पढ़ पढ़ा के बच्चों को. Top consultants in Hyderabad. 80% of them today, top cardiologists, neurologists in Hyderabad were all my students once upon a time like you. Even they didn't know the same things which you didn't know, right? So remember, methionine synthase require vitamin B12. Homocysteine to methionine, you require vitamin B12 is what you need to remember. Once more, how is folate and vitamin B12? They both are merging in. Is very important topic, doctor. So I will send you quickly 10 points to remember in relation to this in the WhatsApp. Now, a neonate presents with the seizures, cherry red spot, hexosaminidase A deficiency. Which substrate is accumulated, doctor? One MCQ in every NEET PG invariably comes from the mucopolysaccharidosis. So what is this called? Niemann-Pick disease, right? Gotches. All this you should remember, right? So it is the GM2 ganglioside. Only 4 of you correctly answered, right? Next. Tay-Sachs is hexosaminidase A deficiency leading to GM2 ganglioside accumulation with cherry red macule. But what is important? No hepatosplenomegaly in Tay-Sachs. So what is the differentiating factor between Niemann-Pick, Tay-Sachs? Niemann-Pick, Tay-Sachs. Examiner's favorite question. But in Nalagu, dil laga ke jana. Right? Did you get that 840 topic list? PDF of 840 topics you need to master. I'll send you. Under WhatsApp group, 75 NEET PG mock test WhatsApp group. Okay, I'll send it. 840 topics, 200 MCQs, you can fully answer and come out. Hydrochlorothiazide develops neuropathy, heart failure symptoms. Which deficiency is most likely? Develops neuropathy and heart failure symptoms. Cashon's cardiomyopathy. Cashon's cardiomyopathy. But long-term hydrochlorothiazide, that is an interesting push examiner is trying to give you. Right? Very good. 5 of you correctly answered. 2 of you are tempted for selenium-induced Cashon cardiomyopathy. I know, but it is thiamine, right? Yeah. Thiamine deficiency lead to both neuropathy, dry beriberi, and wet beriberi, which is cardiac failure, right? And it is the ATP metabolism which is affected whenever the thiamine which is required for coenzyme A formation, right? Next. Insertion of a nucleotide at position 4 in mRNA sequence leads to frameshift mutation. What is the likely outcome, doctor? Yes. What is the likely outcome? Position 4 in frameshift will cause complete change protein, partial protein production effect aitada. What exactly will frameshift mutation will do? Right? Yeah, very good. So, two of you correctly answered. Complete change in protein. Frameshift ante pura naseeb badal gaya. Ek labz mein. So, reading the frame is altered. The downstream codons will change and the protein sequence is altered. Premature termination of the chain can happen. That is typically the effect of frameshift mutation. Now, doctor, a patient develops skin cancer, hypopigmentation after sunlight exposure. What is the DNA repair mechanism which is defective? So, every NEET PG you go, one question comes on DNA polymerases. Okay, DNA polymerases. Polymerase type 1, 2, what do they do and all that. Okay. And మీరు ప్రీవియస్ ఐఎన్ఐసిటి అండ్ నీట్ పీజీ క్వశ్చన్ చూస్తే నాన్ హోమోలోగస్ ఎండ్ జాయినింగ్ అని ఒక సోది మెకానిజం ఉంటుంది, అదే అర్థం చేసుకోవాలి. రైట్? దట్స్ గుడ్. బట్ హియర్ ద కరెక్ట్ ఆన్సర్ ఈస్ న్యూక్లియోటైడ్ ఎక్సిషన్ రిపేర్. Right? So now let us look. What is the condition we are talking about? Xeroderma pigmentosum, where the ultraviolet thymine dimers form, is a nucleotide excision repair problem where there is extreme photosensitivity is what you need to remember. So what I did is, example, 2025 paper I took, I checked every question, I mean using AI, past 15 years low. Is it or its variation is there or not? All 200 have one or other variation in the past 15 years papers. So what is needed to be topper? Finishing past 15 years of question papers. Okay. Now, a tall young man with long limbs, hypermobile joints and lens subluxation with the aortic root dilatation, which is Marfan's. Even on telephone, first year MBBS student also will be able to tell the answer. What is your answer? Very good. Oh, excellent. Oh. So it is the fibrillin 1 is what you need to basically remember. Okay. So we need to know Marfan syndrome, fibrillin 1, FBN1 gene mutation, aortic root dilatation, lens dislocation. Which direction? Upward direction. What is the other condition where you get lens dislocation? Weil-Merkensenis syndrome. Weil-Merkensenis syndrome. There it is, downward. Homocystinuria, also downward. Okay. And there is an aracanodactyly. Now, there is an orange colored tonsils, extremely low HDL, only 5 milligram. Normal HDL ఎంత ఉండాలి doctor? 40 and above. Low HDL. What is the diagnosis, doctor? Angina. Very good. Easy question. Excellent. So, almost 3 of you correctly answered. It is Tangiers disease is what you need to remember. Now, now let's look at the next question. A patient with elevated cholesterol and tendon xanthomas with normal triglycerides. What type of familial dyslipidemia? Well, idoka classification of the dyslipidemia is something that you need to remember. Every entrance you go, one question is there on familial hypercholesterolemias. Pettina number? So, ఇప్పటికి ఎన్ని వచ్చినాయి హైపర్లిపిడీమియాల మీద? దో ఆగే అంటే 200 మార్కుల वो दस्ती डाल के बैठता है ये हाइपरलिपिडीमिया टॉपिक, दस्ती डाल के बैठता है डाययूरेटिक टॉपिक अट्ला. So familial hypercholesterolemia has a LDL receptor mutation. It is called the type 2A pattern. Tendon xanthomas are classical and the triglyceride levels are normal. It is not both LDL and triglycerides. I hope you know difference between cholesterol and triglyceride. Any tension about that? Triglyceride veru, cholesterol veru. Not sure? Cholesterol ante bile salt. Cholesterol is towards bile salt. Triglyceride is different. Anyway, we'll discuss that. Now, a researcher studies programmed cell death. Activation of the caspases is a defining molecular event in the cell death of, in which situation, doctor? Mala, every NEET PG you go, one question comes in pathology from apoptosis. Adi lekunda paper ledu, right? Yeah. So what is your answer, doctor? You are betting only on apoptosis? Let's see. Very good. 6 of you correctly answered apoptosis and pyroptosis. Definitely not in necrosis. Necrosis and apoptosis are like BJP and BRS. They don't belong to the same party. Caspase-mediated death is a feature of apoptosis classical pathway. Well, apoptosis la rendu pathway lu unnai. Classical pathway, alternate pathway. Pyroptosis is inflammatory capsasis is what you need to remember. Okay. Whereas necrosis is caspase independent situation. So all differences between necrosis and apoptosis is the favorite question of the examiner. Right? Right. Next. A 6-year-old man with bleeding manifestations and fatigue. Peripheral smear shows abnormal promyelocytes or rods. Easiest cheap chitaka question. It tappu vedite opkom. So quickly remember, every NEET PG you go, leukemia, lymphoma, leukemia, lymphoma. If some student comes out and say, "Arey yaar, some question came from leukemia, yaar," then they are not gone to the exam itself. So 4 of you rightly answered T1517. So acute promyelocytic leukemia is a subtype of AML. Okay? And what need to be remembered? It is the PML, RARA fusion. Need to be remembered. Second, ATRA, all-trans retinoic acid. Wonderful response comes in case of acute promyelocytic leukemia. 15-17 translocation to be remembered. Another favorite question of examiner. ATRA was started to the patient. Right? After that, he developed hypoxia. That's called ATRA syndrome to be remembered. Right? Now, a lymph node shows follicular lymphoma. అడగంగానే వచ్చింది. ఒక లుకీమియా వడ్డిస్తారు, ఒక లింఫోమా కూడా వడ్డిస్తారు every exam లో. It has centrocytes, centroblasts, and immunohistochemistry shows BCL2 positivity, CD10 expression. What is most commonly associated? The one who didn't go prepared to the exam on ALL, AML, CLL, CML, and APL, right? And hairy cell leukemia. Totally gone. 5 of you correctly answered. T, 14, 18. Excellent, doctor. Follicular lymphoma, this case is. There is an overexpression of BCL2. 14, 18 translocation. It is a tumor originating from the germinal center, and it is a very indolent lymphoma, is what you need to basically remember. Okay, doc? So let's go to the next question. Painless testicular mass, ultrasound shows well circumscribed, homogeneous, non-hemorrhagic tumor. What is your diagnosis, doctor? Once more, testicular cancer, ovarian cancer, cervical cancer, endometrial cancer, breast cancer. Like that, ఒక 20 క్యాన్సర్లే వేసుకోవచ్చు. 200 క్వశ్చన్లో 10% are oncology. What is your answer? Very good. Nice to see Satvik, Kota, Pavani, Moni, Abbas, Shruti, Shri. Yeah. So what is your answer? Let's see, doctor. 6 of you rightly answered. Seminoma. Right? So the most common testicular tumor is seminoma. It is homogeneous ultrasound mass is an important clue. What is very interesting and most important thing to remember, how is the AFP level? AFP level by rule is normal in seminoma. If the AFP is elevated, it is not seminoma. Favorite topic of the examiner. And HCG sometimes is elevated, and yes for seminoma, yes for radio-sensitive tumor is what we need to remember. Right? So now, doctor, a child presents with a visual disturbance, delayed growth. Imaging shows a supracellular mass. Histopathology shows wet keratin and cystic spaces. What is your diagnosis, doctor? Supracellular anangane egir gante answer cheyali. Enduku posterior fossa mass is medulloblastoma. Supracellular anangane supracellular anangane prolactinoma కావచ్చు, craniopharyngioma కావచ్చు. Craniopharyngioma agar hai to let us see. 3 of you correctly answered. Beautiful. Craniopharyngioma. Okay? Yes. So rat case pouch is the origin of supracellular tumor, which is craniopharyngioma. Right? Wet keratin is the hallmark. Calcification is very common. So mala craniopharyngioma, how does it look? Radiological ga kuda chudale. Okay, doc? Next. Let's go to the next question. 15-year-old boy, jaundice and splenomegaly. Father also had similar illness. Increased MCHC. What is your diagnosis? Increased MCHC anangane patayala. Answer. Increased MCHC. What is your answer? Increased MCHC means decreased volume or increased volume of the RBC? Concentration increases if the volume decreases, right? Because volume is there in the denominator. Let's see who is the correct answer. Very good. Hereditary spherocytosis. Mere iron deficiency or thalassemia, they're all microcytic anemias. MCV decrease aitadi. So hereditary spherocytosis lo MCHC increase aitadi. Spectrin defect, extravascular hemolysis, increased MCHC, spherocytes on smear. Splenectomy is the treatment. Very important. How will be Coombs test in hereditary spherocytosis? Coombs test positivity is a feature of autoimmune hemolysis. Hereditary cerebrosidosis by rule is non-autoimmune. And the question Coombs test must be negative. Next, a researcher want to compare and quantify the surface CD markers. What is the best test, doctor? Easy question. Very easy question. Chapala answer. Yeah? Srija, what is your answer? Huh? Flow cytometry? Oh, flow cytometry jepta, I would have been happy. Anyway, so let us see. Flow cytometry and a trick untadi. That is the one which is used for the what you call the CD4 estimation. So CD marker quantification is basically done with the help of fluorescent antibodies, and immunophenotyping method is what we need to remember. Are you fine, doctor? Yeah. You're waiting for anyone? Okay. He'll come. You are from which college? Ion. AIYAN. Oh, very good. I have a lot of students in Ion. You attended? Fourth year? Ah, very good. Very good. Did it help you? Really? Okay. Let me once more help you for topping the PG entrance. Thyroid mass, dysphagia, dyspnea, synaptophysin, chromogranin, amyloid, positivity. What is your answer? Medullary thyroid cancer. Only 4 of you correctly answered. Right? Yes. So you should know, doctor, medullary thyroid cancer is C-cell origin, calcitonin secretion, amyloid stroma, red mutation, and neuroendocrine markers which are positive. Pavani, you stay in nearby? Padmanabhara? Very good. Me friend? Padmanabhara? Very good. So bring all your hostel mates. Tomorrow class. Huh? Good. Every Thursday we have a full-scale mark test and discussion. Evening. Sunday morning we have a full-scale mark test and discussion. Last 2 months, every day mock test and discussion. July and August. Antavaraku, other than Thursday and Sunday, every day evening, right? We will have a aims and INA, CET and NEET PG live revision. Okay. Histology slide shows transitional epithelium stretching, dome-shaped superficial cells. Very easy. ఇప్పటికి ఎన్ని క్వశ్చన్లు అడిగాడు వాడు epithelium మీద 2 అడిగిండు. One was that and second is this. So you need to know it is the urinary bladder and ureter, right? Where you have transitional epithelium, dome umbrella cells is what you need to remember. Now, a pedigree shows autosomal dominant inheritance, with affected individuals worsening in successive generations. What is this? Where do you see this? It's called phenomenon of anticipation. That means grandpa didn't have dementia. Grandpa had dementia at 70. His son had it 50. Grandson had it by the time he is 20. It's called phenomenon of anticipation because of CAG, trinucleotide repeats in Huntington's disease is what you need to remember. 4 of you correctly answered. Excellent, doctor. Now, what is that autosomal dominant? It is an autosomal dominant disorder. CAG, repeat disorder, chromosome 4 mutation, neurodegenerative, anticipation phenomena. Like a parrot, you should rattle in the tomorrow's exam. Now, doctor, a middle-aged woman Dry eyes, dry mouth, anti-row, anti-law. What is the underlying pathological mechanism? Good to see Satvik, Abbas, and many more who are all online. Yes, doctor. Anti-law, anti-row. Munda, first of all, what is your diagnosis? System Jogrens, xerostomia, xerophthalmia. So if you happen to take out the salivary glands and look in histology, what do you get? Lymphocytic infiltration into those glands because of the autoimmune effect. So remember, SLE, rheumatoid arthritis, right? Then Jogrens, systemic sclerosis, totally 8 connective tissue disorders. 8 into 10 points, 20 points. 150 points ready gundala. Right? I'll send it tonight. Jogrens is autoimmune endocrinopathy. Anti-row, anti-law, antibodies is what you need to basically remember. Keratoconjunctivitis sicca. Now, doctor, let's go to the next question. Meralgia. Nana chudu, abba etelladu. Kindunnada? Emayindi? Meralgia is used in severe eosinophilic asthma. What is the receptor on which it acts, doctor? Malla. There are 20 monoclonal antibodies listed. I'll send that list. So, chivariki ఏమైపోతుందంటే ఇది సూపర్ మార్కెట్ లిస్ట్ లాగా రెడీ అయితే ఒక 400-500 list you need to remember. Okay, so I can see 4 of you correct. Interleukin 5 receptor antagonist is what you need to basically remember. So anti-IL-5 receptor, eosinophil depletion, severe asthma, we use the bevacizumab, and it is antibody dependent cell mediated cytotoxicity mediated killing pathway. It is involved. The interleukin 5. Okay. Next, doctor. So one monoclonal antibody out of 20 monoclonal antibodies, sure shot in the exam. A woman with migraine and family history of coronary artery disease is on a prophylactic therapy. Once more, doctor. Migraine, Parkinsonism, pharmacology. You need to be very sure. What is used prophylactically? What is used curatively for the treatment of migraine? Yeah. What is your answer, doctor? Migraine and family history of coronary artery disease. Let's look at the answer. Propranolol, the beta blocker, has got a prophylactic effect. Some of you are tempted towards triptan and ergotamines. They're all curative. So beta blocker therapy, propranolol is common drug, whereas triptans are for acute treatment is what we need to remember. Next. A patient with tumor lysis syndrome has hyperuricemia. Pegloticase is being given. What is the mechanism of pegloticase, doctor? How does it act? Pegloticase. What is the mechanism of action? So once more, gout management. Will you give allopurinol in acute gout? Contraindicated. Never give it. Allopurinol only after the patient stabilized. Otherwise, you give NSAIDs are the treatment of choice for the acute gout. Okay. Now, so here there is a hyperuricemia. It is it oxidizes the uric acid, which is the mechanism of action. So recombinant uricase enzyme, pegloticase, uric acid to allantoin, it is being used. What is tumor lysis syndrome? Whenever you give ATRA-like therapy, Every time the tumor cell breaks, it releases the nucleotides, which are metabolized into uric acid, that lead to hyperuricemia. Same time, they release potassium, which is intracellular ion, so you get hyperkalemia. They release phosphate, which is intranuclear, so hyperphosphatemia. That will sequester calcium, that lead to hypocalcemia. So hypocalcemia, hyperkalemia, hyperphosphatemia, hyperuricemia is equal to tumor lysis. So which drug increases the lower esophageal sphincter tone and promote the gastric emptying, which is very commonly used, right? So how does cisapride act, which is a prokinetic drug? How does metoclopramide act? You need to be very, very sure, doctor. Okay? So let us see. 5 of you rightly answered it is metoclopramide. Only 1 answered it as pantoprazole, but that is not true. So, D2 receptor antagonist is that one, metoclopramide. Okay. Now, patient on hydrochlorothiazide for hypertension later develops renal stone. What is the cause for it? What did we say? We got the same question, right? Okay. This already we finished, right? Okay. Now, doctor, a patient with HIV developed TB. Whenever you crack PG entrance and also marriage proposal comes, marry first or PG first? So also is HIV and TB. HIV treatment first or TB treatment first? Favorite question of examiner. Huh? Let's see what is your answer. Yes. So you should know, start ATT, then ART after 2 weeks is considered to be the management of choice. So HIV TB co-infection, ATT first, ART after 2 weeks. Once more, out of 200 MCQs, 2 questions invariable on HIV. Because HIV comes in medicine, pharmacology, microbiology, so many subjects. At least 2 straight from the examiner's question bank. And if you come out of exam hall and say, "Arey yaar, kuch HIV ke baare mein pucha hai yaar," then you are innocent. You are in a different world. No problem. All begin from that world only to become toppers. HIV has multi-drug resistant TB. What is the regime which is used and recommended when there is a HIV plus TB is the favorite question of the examiner. Once more, हम इस देश के वासी हैं जिस देश में TB बहती है. So that's the reason every examiner's favorite question, doctor. Right? So what is your answer? Punch your confident answer. Yes, let's see. So, it is monitor for iris, immune reconstitution syndrome. So, BPA-LM regime for MDR-TB, bedaquiline, pretomavir, linezolid, moxifloxacin, they're all included, but you need to look for any immune reconstitution can occur. You need to be very careful about, right? Next, doctor, a patient on haloperidol develops orofacial movements consistent with tardive dyskinesia. How do you treat the tardive dyskinesia? Once more, doctor, antipsychotics, antidepressants. In pharmacology, we never read. Even our postgraduates in MD first year also don't know who cracked seat. I'm a professor of medicine, right? How they got seats, I ask. Right? Antidepressants and the antipsychotics. So you should remember, it is valbenazine which is being used in order to treat the tardive dyskinesia. So fundamentally, what will haloperidol like drug will do? It is antipsychotic. It will cause the depletion of the dopamine. So we use a VMAT2 inhibitor drug, which is valbenazine therapy, in order to treat the tardive dyskinesia. See, basically, if your dopamine levels are high, you will get psychosis. If your dopamine levels are low, then you get Parkinsonism. Only two things you need to decide between. That's the reason all antipsychotics which deplete the dopamine will lead to drug-induced Parkinsonism, is what you need to basically remember. Come on. Whenever there is a supraventricular tachycardia and you need to give a long-term prophylaxis, which drug is most appropriate, doctor? Adenosine? Adenosine for acutely. So once more, SVT, VT, VF, AF, WPW. Like that, there are not more than 20 arrhythmias and their ECGs should be ready. Right? So what is your answer, doctor? Verapamil, the calcium channel blocker, is one which is being used long-term prophylaxis. Right? So calcium channel blocker, verapamil is very effective. Adenosine is for acute therapy. And how does verapamil will help? It lead to the AV nodal blockade, is what you need to remember. Right? Next. A patient with asthma uses salbutamol, ipratropium, but continuously is having nocturnal exacerbations. So among the beta-2 agonistic drugs, what is the classification, doctor? LABA, SABA. So short-acting beta-2 agonist like salbutamol, right, will not help. So you need to use long-acting like salmeterol, right? So what is your answer? Yes. So you should know LABA plus inhaled steroid is considered to be the management of choice. Now, so whenever asthma is there, you need to give inhalational corticosteroids like budesonide plus LABA combination to control the nocturnal symptoms for the management of persistent asthma, is what you need to remember. Okay, so ఇప్పుడు రెండు క్వశ్చన్లు వచ్చినాయి ఆస్తమా మీద. One was your bivalikumab and other is this. Group A Streptococcus causes bacterial pharyngitis. Which component of it is the one that binds with the pharynx? So last 15 క్వశ్చన్ పేపర్లు తీసుకుంటే 15 అడిగింది స్ట్రెప్టోకాకస్ మీద. స్ట్రెప్టోకాకస్ స్టఫైలోకాకస్ మీద లేకుండా క్వశ్చన్ పేపరే లేదు. మీరు ఆ 840లో కూడా 400 టాపిక్స్ చెప్తా. డిసెండింగ్ ఆర్డర్లో 400 టాపిక్స్ అయితే చాలు. So group A is Streptococcus. It is the lipoticoic acid. Very good. 6 of you correctly answered. So it does fibronectin binding, is what we need to remember. Next, a sewage worker, fever, jaundice, renal fail, conjunctival suffusion. It is a closest mimicker of malaria, but not malaria because of the jaundice, right? It's called Leptospira icterohemorrhagica, which lead to Weil's disease Leptospirosis is what you need to basically remember. Now, several villagers developed dysentery after consuming raw milk. Gram-negative curved rod with polymorphonuclear infiltration. Curved rod anangane pedeyal answer. Raw milk. Okay, another important clue. Gram-negative curved rod in the stool examination. Right. So, Campylobacter jejuni. I know what is the temptation. Oh, nobody answered Vibrio, no? Okay, good. Asal mundu Staphylococcus aureus is gram-positive. Somebody answered. So, curved gram-negative rod, raw milk infection, inflammatory diarrhea, and PMNs in stool is our favorite. Campylobacter jejuni is what you need to do. So, after getting a Campylobacter jejuni infection, after a few days, patient developed acute flaccid paralysis. What is your diagnosis? Guillain-Barré syndrome, which is post-infectious demyelinating polyneuritis, is what you need to remember. Right, very good. 5-year-old child has nocturnal perianal itching. Every NEET PG exam, one platyhelminthes, nematohelminthes, which we left in intermediate, will come. Adhesive tape reveals characteristic ova, right? So that's called tape, anal tape. Enterobius vermicularis is what you need to basically remember. Pinworm, it lead to perineal itching. We use Scotch tape test, which you need to remember. And children, it is very common. Enterobius vermicularis is also called pinworm. Mala, pinworm ante, whipworm ante, roundworm ante, anni worms ready ga petkuni exam povale. Okka worm ustadi. Mala, how do their eggs look like? Whose eggs will be floating in saline, which are bile stained? Until exam, we need to remember. But good news, very fixed data is there to remember. Come on. Chronic cough, weight loss, narrow-based budding yeast. Always remember, broad-based budding yeast. Broad-based, B is blastomycosis. Broad-based, narrow-based budding yeast is what? Definitely not blasto. B for blasto, B for broad-based. Yes. Are you ready with the answer? Good. So you should know, doctor, the histoplasmosis. Manu, take the snap in. So, narrow-based budding histoplasma, bird droppings, intracellular yeast, which is there in the macrophages, pulmonary fungal infection is what you need to basically remember. Now, doctor, chronic meningitis, gram-positive filamentous branching bacteria that are weakly acid-fast. Anangane pattayal answer. Acid-fast, weakly, gram-positive filamentous branching, right? And grow on paraffin culture. So, doctor, what is your answer? You should know it is Nocardia asteroids, but not actinomycetes. So, branching filamentous weak acid fast is Nocardia. Paraffin bite culture is the important clue, right? Once more, differences between Nocardia and the other one, actinomycosis. You need to know 4 or 5 differences of a table that you need to, right? Lot of times students have a confusion. First thing, next MCQs are. Start game with PYQs. Every day solve 200 PYQs. बाद में देख लो. Right? Theory notes is like what? Practicing in a park. Solving PYQs is going on a highway, road. So that is very important. Now, fever cough hemoptysis has valve microscopy showing septate hyphae with acute angle branching. Acute angle is the clue. For acute angle, septate hyphae. Yes? You should remember aspergillosis. Aspergillosis is what you need to remember. Acute angle branching, septate hyphae, invasive fungal infection is aspergillus. Now, doctor, 16-year-old girl, 23-year-old man undergo medico-legal after allegation of rape by the girl's parents. The girl states that act was consensual, no injuries are found. According to the Indian law, what is the legal status of consent in this case? Yeah? So you should remember, consent is invalid if the girl is under 18, right? Even if she says consensual, if she is below 18, parent opinion prevails. POSCO applies for the minors. It is a non-bailable offense. POSCO. Next, doctor. During autopsy, curved nail scratches below the mandible, grouped bruises on the neck, and fracture of the superior horn of the thyroid cartilage. Multiple bruises are present on the trunk and shoulders. What is the cause of the death? So, asphyxial deaths is the favorite topic of the examiner. Yeah? Hyoid fracture is an important clue. So, the correct answer is throttling. Right? So, manual strangulation, fingernail scratches, neck bruising pattern, thyroid cartilageal fracture, that is all an asphyxial death. Of throttling is what you need to remember. Okay? So, during forensic exam of an incised wound, the wound edges are widely separated due to skin tension lines. What is this phenomenon called as? What is this phenomenon called as? It's a very simple application of the English in forensic medicine. Right? So, it is gaping wound tension. Langerlein's tension, wound edges gape, incised wound feature it is what you need to remember. All right? A man accused of homicide claims that he had delusion of persecution during the act and pleads insanity. What is the most appropriate medico-legal next step, doctor? First, you need to prove a psycho is a psycho, no? Ask him to take NEET PG exam. It will prove. So you need to do psychiatric evaluation. Okay? Now, doc. Protection of children from sexual offenses provides legal protection. What is the age group? POSCO. So after the mayhem in West Bengal, now every NEET PG exam compulsory, the POSCO Act questions will come. So what is your answer, doctor? Let's see. All children below 18 come under POSCO Act. Right? Next, doctor. A diabetic patient hospitalized with COVID-19 dies. Which type of surveillance does this represent? Routine reporting system. Very good. So it is the passive surveillance is what we need to basically remember. Only 2 of you correctly answered, right? So next, in the de facto method of census, information is collected based on what? In the de facto method of census, is it the residence, place of employment, place of birth? Let's see. What do you guess? It is a location during the census. अगर पद्मनाभ नगर में नीट पीजी प्रिपेयर हो रहे हैं तो आपका सेंसस इधर काउंट होगा, not in Surabhi College. Next. So, doctor, the Nalgonda technique of defluoridation uses which combination of chemicals? Nice to see Satvik and many more who are all online. Yes, what is your answer? So, chlorination, defluoridation. Inevitably, one question comes. So, doctor, you need to remember, it is the alum and lime, which are the ones which are being used in the Nalgonda technique. Alum for the coagulation step and lime for precipitation step is what we need to remember. Now, what sequence represents randomized control trial? So, fundamentally, to avoid the bias, we use the randomization as a trick. So, randomized controlled trial. One loud answer, doctor. Let's see. So, you need to remember randomization, manipulation, follow-up assessment. Right? So, let's look into it. Oh, sorry, I missed the explanation. So, randomized control trial, what will you do? Neither the one selecting doesn't know, nor the one who is assessing doesn't know which group a given patient is going into. Now, a resident of AP with bowed legs, fluorosis from groundwater, which measure should not be done in the management? What will you do? So, fluorosis is a very big area, doctor. So, it is the fluoride supplementation, don't do. Like giving diuretics to a DKA patient and fluids to the CHF patient. Simple question. Urban city has a population of 70 lakhs, 30% in slums. How many urban primary health centers are required for this population? So what is 30% of 70 lakhs? 2 lakhs. No, 20 lakhs. So 1 lakh kundala, 10 lakhs kundala, 10,000 kundala. So this is a simple algebra question. $42. Okay, so what is the logic? For every 50,000, you need to have one. So for 1 lakh, you need to have 2. There are 22 lakhs, which is 30% of 70 lakhs. So 22 into 2 is equal to 44. Huh? So that's the point. A study comparing mean hemoglobin between two independent populations, a mean with another mean. Where will you calculate mean? Discrete variable aitena, continuous variable. Discrete ante yes no is the answer. Are you pregnant? Not pregnant. There is nothing like slightly pregnant. But are you tall or short ante? They can be short, shorter, shortest, long, longer, longest, everything can have. That is continuous variable. So height, weight are continuous variables. Yes or no kind of answers are all discrete variables. Discrete variables, Kemo, you will be using chi-square test. Whereas continuous variables, you calculate mean and compare, and there you use unpaired t-test. Okay. Now, next, doctor. Which mosquito larva lacks a siphon and rests parallel like Sri Mahavishnu on the water surface? What is your answer, doctor? It has no siphon and it sleeps parallel to the surface of the water. Which one it is? You update Rakesh. Rakesh. Yeah. So what is your answer? Good. Anopheles. Right? Good number of you chosen Mansonites, but hard luck. No siphon larva parallel to water surface. Anopheles identification. Egg is laid singly. So tomorrow you will become IVF specialist after doing MD gynops. That time you will be thinking, kya padne ke baad top rank aaya? You have to remember this also. Huh? Now, next, doctor. 3-year-old child with bowed legs, poor nutrition, little sunlight exposure has rickets. Which government program under 6 nutritional deficiencies in children? The name itself tells. So, it is the integrated child development. I know, national deficiency control. No, there is no such program actually. Okay, ICDS, Anganwadi workers, ASHA workers, everything you should be sure. Now, this is fundamental question. What is the composition of the tablets of the iron folate given in 10 to 19 years? Is the question paper so easy? Actual paper me rashan kada? Even a question lo. Hi, a question to bahut nazuk hai, very easy to crack. Come on, what is your answer? So, you need to remember 100 mg iron, 500 mg micrograms of folate is what you need to remember. So, 100 mg elemental iron, 500 micrograms of folate, weekly supplementation, not daily, weekly. Prevent anemia adolescents. Next. A population strategy to prevent coronary artery disease. What does it recommend cholesterol intake per day? How many pizzas you can eat every day? According to population strategy. Yeah. So what is your answer, doctor? So 200 mg per 1000 kilocalories is considered to be the treatment of choice, right? Next, which step of health program management measures achievement of objectives and assess the quality of the outcomes when you come to Padmarao Nagar Center to prepare for entrance exam. Yes. What's your answer, doctor? So you should know it is called evaluation. Okay? So we need to evaluate every day how much we progress, how many PYQs we answered. So it is a health program evaluation which will check on the outcomes assessment is what you need to remember. Researchers allocate 20 PHCs to standard care, 20 PHCs to receive community intervention. What type of study design you call this? Yeah? So in a class, 50 students went to coaching, 50 students prepared themselves. What is that study called as? So, doctor, it is called cluster randomized trial. Each 20 PHC is a cluster. You randomized it, right? So, cluster allocation design. Now, what is the time interval between acquisition of infection and reaching the peak infectivity is called as? Peak infectivity. So all this looks similar, but they have a slight difference. You need to know the difference. Yeah. Acquisition of infection and reaching the peak infectivity. Like to answer? Incubation. Serial. Generation time. Very good. Very good. So you should know the generation time concept where disease transmission timing is being decided is the peak infectivity interval is what we need to remember. Okay. Now, in a breast cancer screening, 5-year survival rates, but mortality remains unchanged. Which bias? Because the cancer screening, 5-year survival increased, but dying because of the cancer is unchanged. Yeah, so what do you like to call that as? You like to say? It is called as lead time bias. So what is lead time bias, doctor? What is the meaning of lead time? Because of the screening program, you are detecting it early, right? For example, 5 years, I die by 5th year. But earlier, before screening program, by 4th year, I am being diagnosed and I lived only 1 year. Where the screening, I am being found on 1st year, early, but still died at 5th year. So mortality didn't change, but it looked like 1st year to 5th year he lived means, oh man, your survival time has increased, you are thinking. But that is not true. So that is called lead bias. You got the lead. The patient is having the disease early, so he lived up to that date, but the date did not change. That's the point. Beautiful question. Huh? Now, 2-year-old with recurrent epistaxis with nasal obstruction. Bowing of the posterior nasal wall of the maxillary sinus. There is a name given to this clinical sign. It is anthracoinal polyp is what you need to know, doctor. So whenever in maxillary sinus you are having a polyp, there is a choanal extension in young patients commonly, leading to unilateral nasal obstruction. That's how it clinically presents. Once more, you should know ethmoidal polyps versus anthracoinal polyps of maxillary sinus. 4 differences, one table. Right? Similarly, juvenile nasopharyngeal angiofibroma, where rapid bleeding occur, epistaxis, in a younger males, it is more common. Right? END la 25 topics ఉన్నాయి. ఆ 25 లోంచే వస్తాయి ఆ 7 questions. Okay? Now, 72-year-old hoarseness, dysphagia, vocal cord carcinoma involving subglottis and thyroid. What is the appropriate surgical procedure done? Total laryngectomy. So basically you need to know what are the options available. Whenever there is an advanced laryngeal cancer with the cartilage invasion, total laryngectomy is indicated. You should know what are all the choices in laryngeal carcinoma clinical management. Okay, doc? There is a central perforation of tympanic membrane. Air-bone gap on audiometry. Normal bone conduction. What is your diagnosis, doc? So you should know Weber's test, Rinne's test, etc., etc. Yeah. So air-bone gap kaha hota hai? With a normal bone conduction, with a central perforation. What is your diagnosis? So it is left conductive hearing loss. Why? Air-bone gap is present, but bone conduction is normal. Conductive hearing loss is there, right? So it is a middle ear pathology. Tympanic membrane perforation is there. That's the reason. Okay. Now, a patient has a displaced nasal bone fracture after trauma. Which instrument is specifically used to close? ఇది తెలిస్తే తెలిసినట్టు, లేకుంటే లేనట్టే. లుక్ ఎవడో, బయోనెట్ ఎవడో, వాల్ష్మెన్ ఎవడో, ఎల్లయా పుల్లయా ఆఫ్ లండన్. Okay, if you know, you know. You don't know, you don't know in entrance exam, right? It's called Walshman's forceps. So totally there are about 50 surgical instruments that you need to remember for the exam. So Walshman's forceps, closed reduction technique. You should also know how to recognize those 50 surgical instruments. One of them will come in the exam. Starting from Cusco's forceps sometimes, suture material, types of scissors and all that. I'll give you that list. Now, next. 45-year-old, unilateral hearing loss, tinnitus and imbalance. Cerebello-pontine angle tumor. Which one it is? Come on. It is the Mudduperu of the cerebello-acoustic neuroma. Danne mari inkoka parenti. Yeah? It's also called schwannoma. Right? Easiest questioning adi. Right? Chronic ear discharge, central tympanic membrane perforation, conductive hearing loss. What is the definitive treatment, doctor? Central tympanic membrane perforation. So we need to remember, it is the myringoplasty, right? So tympanic membrane repair is called myringoplasty. especially when chronic otitis media with conductive hearing loss is there. To restore the middle ear, we need to do the myringoplasty is considered to be the management. Once for ASOM, CSOM, compulsory one question. And different types of mastectomy, you need to be ready, which is called step up, step down, etc. Next. Severe anterior epistaxis refractory to packing and cautery. So surgical ligation is planned. Which artery is primarily ligated up? So you should know anterior epistaxis, posterior Little's area, Woodruff's area, everything. Which is the branch of which vessel? That also. Yes. So, doctor, two of you rightly answered sphenopalatine artery. Right? So, you should know posterior part of the nasal is supplied by sphenopalatine artery is the source. And it is a branch of the internal maxillary artery, which is the branch of the Chepala. External carotid branch. Internal carotid does not give any branches in the neck, only inside the calvarium. So what are the branches of internal carotid? External carotid. 7 branches of the external carotid. Tonight only revise. See, the whole idea is, after revising 200 questions, right? 200 questions, you should make a list. Kya revise karna quickly. Then tomorrow another 200 questions. Like that, within about 100 days, 50 days, you almost all know what examiner asks. Ade unta story. There's no big deal. Okay? Elderly patient with dandruff-like deposits in the anterior lens surface seen on the slit lamp. So what is this, doctor? Most likely anterior lens surface. So there is an entity which is called pseudo exfoliation syndrome, which you need to know. So what is that? Typically, pseudo exfoliation is seen in elderly patients when the anterior lens capsules leads to the production of the pigment deposits, which will block the anterior chamber, canal of Schlemm, leading to the development of the glaucoma. That's called pseudo exfoliation glaucoma, is what we need to remember. Okay, now, which condition is used to treat the ring shown in the image? Okay, I think image should be there. So it was keratoconus was there. Okay, keratoconus was there. What is that sign in keratoconus called as? Munson sign. So the lower eyelid, when they droop forward, will become conical. That's called Munson sign. Okay? 15-year-old, painless, slowly progressive mass lateral to the lateral canthus, present since childhood. What is that, doctor? It is the problem in the fusion of the myotomes, which lead to the development of it. It is called dermoid cyst, is what you need to remember. Okay? So, superotemporal area, congenitally present, painless swelling, common orbital cyst, which is found in the children. Now, doctor. A patient has a guttate lesion in one eye and bullous keratopathy in the other eye. What is the most likely diagnosis? Keratopathy ante evari pati adi? Cornea. Bullous keratopathy with guttate lesions in one eye. So there is a name given to that. Indula name edundi okate. Right? So it is the Fuchs endothelial dystrophy. Even if you know 840 topic list perlu, You will be able to answer. ఎందుకంటే అందులో నుంచి వస్తాయి ఆ టాపిక్ పేర్ల నుంచి. Now, next, binocular single vision. Our two eyes are watching, no? Single vision consists of which components? Right? Binocular single vision. So it is the SMP and the fusion. So simultaneous perception, fusion, stereopsis is the third step. Stereopsis means perception of the depth. And binocular vision stages, which we need to remember. Once more, strabismus, concomitant squint, different types of strabismus, divergent and convergent squint, everything you should know. At least one question will come on visual field defects. Which level is the defect based upon the hemianopia? Where will you get quadrant anopsia, superior and inferior quadrant anopsia? Everything you should be ready, doctor. Which statement is true about orbital cellulitis? In orbital cellulitis, do you get an abnormal eye movement or normal eye movement? So what is true statement? Orbital cellulitis is a very common clinical condition day in and day out. So it is the ethmoidal sinusitis. Because the orbital plate is very close to your ethmoidal sinus, right? So posterior septal infection, painful eye movement, proptosis, ethmoid sinus is most common, and emergency condition is orbital cellulitis. Okay, so what are the causes of painful, painless proptosis? Painful, painless vision loss, sudden vision loss. List. You should be ready. Okay. Now, next, doctor. Unda petrol ayipinda? 823. Too much studies is too bad to health. Unda petrol ayipinda? Todara meer cheppale. Meer chepte nenu kacheri band chestanu. మనం ఎన్ని గంటలకు మొదలు పెట్టాం? How many hours? 2 hours. 2 घंटे. 2 students came, we got energy to teach 2 hours. So tomorrow bring few of your other friends. So we will be able to persist for 3 hours to complete it. All right? If you enjoyed the class, I'll send a PDF of all the questions along with short explanation. అట్లనే ఒకసారి తనకి గ్రూప్ లింక్ గ్రూప్లో ఉన్నారా ఇద్దరు లేరా మీరు? సో జస్ట్ షేర్ ద లింక్ సో షీ విల్ ఆల్సో గుడ్ రైట్ డాక్టర్. సో వాట్ ఇస్ యువర్ గోల్? వాట్ ఇస్ యువర్ డ్రీమ్ బ్రాంచ్? యు ఆర్ మై బ్లడ్ గ్రూప్. హౌ అబౌట్ యూ? Wow, that's good. Stethoscope, you can donate me. Right? Dermatology is a beautiful branch, right? So I wish from 1 lakh you should be less than 1,000 ranks by the time August comes, right? Before that we have INI-CET dates vachine. Apply chesara? Okay, good. All right, doctor. Tomorrow we'll try to have it around 5:36. I'll just update you in the group. Tomorrow we're also getting ACs, but it's challagane undi otherwise.